Hi everyone, my name is Jack, and today I'm going to share a deeply personal and scientific exploration of how heart-focused biofeedback and self-compassion training might enhance psychedelic therapy outcomes. My research and healing journey really converge here, and I hope this leaves you with some insight and curiosity. Before we begin, a quick disclaimer. What I'm sharing includes proposed research, lived experience, and harm reduction. There's no medical advice, and this is not an endorsement of anything illegal or not yet approved. And some of the results I'll share are currently in preparation. I came to this work out of necessity. I grew up with a severe stutter and have lived with autoimmune disorders. But as I healed my mind, my body began to heal, and I'm now in remission. This journey led me to neuroscience and to a vision of psychiatry that's rigorous, compassionate, and rooted in lived experience. Along my journey, I met so many people like me who were struggling, especially students and young people. I spent the last 5 years working as a tutor at a community college, and I've seen firsthand that mental health challenges are at an all-time high, and that mental health challenges aren't always separate from physical health challenges. They're really one and the same. As students, we're often put on autopilot, thrown into a system where the ethos is competition and perfectionism. Even when we know about self-compassion, we hear about that, we rarely have the luxury to pause and practice it. My vision is to help humanize mental health care and transform the system from the inside out. This journey actually began when I was 16 years old. I was working with a naturopath who introduced me to biofeedback. And this is a photo from my best session. If you look at the graph, that's showing heart rate variability, HRV. That's the variation in time between heartbeats measured in milliseconds. It's a powerful, non-invasive biomarker of stress and resilience. And it's a little bit counterintuitive. You would think a healthy heart would be like a metronome, keeping constant rhythm. It turns out the more variation in time there is between heartbeats, that's actually showing adaptability. That's showing a healthy nervous system. And that's indicated here with a sine wave. So when someone's in a state of coherence, when their cardiovascular system, their nervous system, and their respiratory system are all in sync, that's coherence, and that's a healthy HRV. That's a healthy nervous system. Biofeedback lets us see these changes in real time, and most importantly, it gives us an opportunity to regulate our physiology. We can't regulate what we don't notice, and that's really the value in this, that awareness is the first step to regulation. So this is a demo of what this looks like. We used HeartMath devices, but there are many different biofeedback tools available. I'm not endorsing any brand. This is just what we used. So there's a device you would attach to your ear or your finger, and it would track your pulse. It would give you real-time feedback on what's going on. At first, the graph's going to look erratic, but with practice, you learn to reach a state of coherence. And the real goal here is to internalize that feeling of regulation. So you can carry it into your day-to-day life, not just when you're in front of a screen. As you can see here, as this raises and lowers, you would sync your breathing with this, and you would try to breathe through your heart, which sounds kind of odd, but you would really just try to feel your heart and feel like you're breathing through your heart. And that's what helps um, make this regulation possible. Self-compassion is a word thrown around a lot, but it's not always well understood. It's much more than just being nice to yourself. It means treating yourself with the same kindness and curiosity you'd offer a close friend. And it's not just a thought, it's something you embody, it's something you feel, and it's a skill you could actually learn. For people with anxiety or trauma, the instinct is often to push away uncomfortable feelings. We automatically label anxiety, fear as bad, something that shouldn't be felt. But that really makes things a lot worse. That's working against your mind and your body, not with it. Self-compassion helps us respond to emotions with acceptance, rather than judgment or avoidance. And clinical psychologists have identified self-compassion as the active ingredient in mindfulness. Mindfulness is another thing we hear about a lot, and it's very useful. But without self-compassion developed along with it, we can still be stuck criticizing ourselves even in the present moment. Before I show you how these skills work together, I want to introduce you to one more concept, and that's interoception. Interoception is your ability to sense what's happening inside your body. So not just feeling your pulse, but true inner awareness. So this could be your heartbeat, this could be your breathing. In fact, now that I mentioned breathing, if you notice you're breathing right now, you may have not been paying attention to it a moment ago, and now you are. I'm sorry. But now that you're paying attention to your breathing, that's an example of interoception. And again, we can't regulate what we don't notice. Psychedelics amplify interoceptive sensitivity, and this can be healing, but it can also be really powerful. It can be overwhelming. And if you're unprepared, it can lead to emotional flooding. It could be too much, too fast. So now I'm going to talk about a study that I conducted as an undergrad. I co-led, co-designed this. It was a randomized control trial. Ended up having 60 students who finished. There was group one. This was our control group who just did baseline physiological, psychological questionnaires, a post about 3 months later. There was a biofeedback group who did training at home. They were given a biofeedback device shown in figure three, and they trained with this at least 3 to 5 days a week, about 10 minutes a day, but they could do it as much as they wanted to. There was a self-compassion group, that was group three. They used the self-compassion app shown in figure two, and this was an app developed by clinical psychologists, and it allowed people to go through different modules. Each one was about maybe 5 to 10 minutes, and it taught them how to really embody self-compassion. So again, not just thinking kind thoughts, but really feeling and practicing self-compassion. We hypothesized that the fourth group, the combined group, would have some type of synergy, that there would be some type of interaction between the biofeedback and the self-compassion that would create an even greater effect. And this group was given biofeedback device and self-compassion app. They did both together. Figure four shows the questionnaires that people did. So there was some anxiety stress questionnaires, there was some emotional regulation questionnaires, and some mindfulness self-compassion measures. These were all done before and after. But before I show you the numbers, here's something visual. So we started the study in the fall when there was that new semester energy, and we ended it it was still the fall, but it was around December, so final exams. And understandably, people were feeling very stressed around that time. Even with this timing of the study, starting when the semester was starting off light, ending when people were feeling a little bit overwhelmed with their semester, there were still some really cool things that came up. So these were self-reported words. We asked participants just to share in one word what they felt. The green words here are the the words that came up, the words that emerged, and as a word cloud, the larger words here were more prevalent. They showed up more often. So even with the timing of this ending around the time of final exams, group four, the group that did biofeedback and self-compassion combined, they felt a lot more grounded, a lot more calm, a lot more content and relaxed. There was still some, overwhelm and anxiety, but there was prevailing sense of equanimity. Now I'm going to share the physiological outcomes. So this was the um, normalized coherence. So again, coherence, looking at the synchronization of the heart, the brain, and the lungs. And what this showed was the combined group had the greatest increase by far. Um, so this was the only physiological outcome that reached statistical significance, and it was really interesting to see. So next I'm going to talk about the psychological outcomes. So there was the perceived stress scale, and this is just, as it sounds, how people perceive their stress. This decreased the most in the combined group. And additionally, with the self-compassion scale, this increased the most in the combined group as well. So the combined group had the most consistent mind-body gains. And we also saw, some of you might be familiar with the GAD-7. This is a scale that corresponds with anxiety disorders, so like generalized anxiety disorder, OCD, PTSD, social anxiety. This also decreased the most in the combined group. So what's really striking about this synergy is that this suggests that targeting both mind and body works better than either alone. We have a mental health crisis that's national and global in scale, and young people who are really the future of our humanity seem to be the most affected by it. So there's a really pressing need to develop new tools. What our study is telling us is that there's some power in helping people connect with their body to feel more embodied, to feel less in their head, more in their body. And these tools that I'm talking about, biofeedback, self-compassion, they can be offered pre and post therapy to improve outcomes. And this could be really scalable. This could be something where people can take these devices home, they can do it on their own time. And this is something that's really missing because although things like cognitive behavioral therapy and medications, they're evidence-based, they're first line, but they're not always helping people feel a sense of agency over their nervous system or over their emotions. This helps people feel a more internal locus of control, feeling more of an ability to self-regulate, and that's really empowering. So you might be wondering how this connects with psychedelic therapy. Psychedelics can be very transformative, but they can also be overwhelming or maybe not as effective if people aren't prepared. So outcomes can vary a lot, and current preparation integration protocols currently focus only on mindset, not physiology. I mentioned this, most people lack agency over their emotional and physiological state, and this protocol could fill that gap, making psychedelic therapy safer and more effective. So this is a cycle that many people might relate to or be familiar with. You feel anxious, you feel stressed, you might suddenly be paying more attention to your heart's beating faster. That makes you more anxious. You feel like something's wrong, and your heart beats even faster. You feel even more anxious. It's a vicious cycle. It's known as a negative feedback loop. It's a self-reinforcing thing that just produces more and more distress. But instead, when self-compassion is learned and when people learn how to embody that sense of curiosity, non-judgment, and feeling all of their feelings, not labeling them good or bad, uh, this allows people to have more resilience, both physiological in their body and emotional. Then when someone develops interoception and when their interoceptive awareness increases through something like biofeedback, that also allows them to gain better emotional understanding, regulation. And then once you bring in psychedelics into this picture, this increases self-compassion and the interoceptive sensitivity even further. So this is a positive feedback loop. And self-compassion breaks that loop that I showed you before with the anxiety, because instead of responding to the anxiety and the physiological response with, this is bad, I shouldn't be feeling this, instead, it responds with, huh, what's my body trying to tell me? And this shift really builds resilience. So I want to get a little bit more specific about psychedelics. So MDMA, it's an empathogen. It increases empathy. It allows people to feel a lot of emotions they might not feel all the time. There's a lot of emotional warmth. and it seems to facilitate self-compassion. So if somebody is primed for an MDMA assisted therapy experience with these physiological and emotional tools, it will allow them to get more out of it potentially. Psilocybin increases interoceptive awareness, and sometimes it produces mystical type experiences that are a lot of times described as being key to their therapeutic value. So sometimes it allows people to feel like their sense of self and maybe their inner critic is not as prominent, and they feel more connected to the world around them. And I think this would also pair really well with the protocol I'm describing. So both of these, they increase interoception, they increase HRV, and they also have a common element of emotional and physiological resilience. Self-compassion and HRV are already things that psychedelics increase independently, even without specific training. So by priming people to have those tools, to have those skills, and to be in that primed physiological and psychological state, it would allow people to get the most out of this as possible, reduce the chance of any adverse reactions, and allow them to have the best chance of carrying that healing into their day-to-day life. So again, this protocol I'm talking about is preparation, where people do biofeedback and self-compassion training before a psychedelic session. Then they have their psychedelic session along with facilitators. But then you also bookend it with integration, again, with biofeedback and self-compassion. So this could be tested in clinical trials. I would love to be involved in one of these in the future where it could be something like biofeedback, self-compassion enhanced preparation, and integration for psychedelic therapy. And this could also be scaled way beyond just a clinic. This could be done in campus health centers. This could be widely accessible. And I want to end the talk with this thought. Psychedelics can open the door to healing, but it's really what we bring in and how we integrate it that shapes the journey. We can help people not just heal, but really remember what healing feels like, to feel joy for no reason, to feel safe, and to feel whole. And I want to thank everyone at Connecticut College who made this possible, especially Dr. Mazamad, who was my mentor, always believed in me, and introduced me to biofeedback research after I was first introduced to biofeedback when I was 16. Sophie Barr, who co-designed the study along with me, the biofeedback self-compassion study. Um, she really made this possible. Dr. Park, who helped us with all of our statistical analyses. Maddie Rose, Varney, and Emily, who were undergraduate research assistants who helped us a lot with data collection because there was a lot to coordinate, especially during a busy semester. Dr. Roland McCready of the Heart Math Institute, who validated our data, and also the Connecticut College Summer Science Research Institute and Neuroscience Department for funding this. They funded not only our full-scale study, but they also funded a pilot study that kind of got this all going. I also want to give a special thanks to Dr. Alessia Balash for serving as my talk coach, providing me very, very valuable feedback and encouraging me. My co-participants who gave me incredible feedback, and IPN and the psychedelics team for facilitating this whole program and helping me share my ideas. And my ideas and research all build on a lot of past research that's inspired me. And if this work is interesting to you, I encourage you to check it out. Thank you so much.